This is a case of facial palsy, and we treated the facial palsy patient. Face present करो, face present करो. You can see the thing. The right side has a facial palsy. आंखें बंद करिए. When he close the eyes, जोर से बंद करें. The left eye is pressurized and closed, but the right eye is not working properly. आंखें खोलें, बंद करें, मुंह फुलाइए. You see the tilting face when he blows his mouth. दोबारा फुलाइए. This shows that the right side has a facial palsy. Now, how we can treat these cases like this? First of all, this is the patient position in supine line. Prepare the patient for the treatment. First of all, wear gloves. Wash with any antiseptic, because it is common reason of facial palsy is the viral infection of 7th cranial nerve, facial nerve. Now, take a spit swab for purpose of hygiene. This is called a muscle stimulator, which stimulates the paralyzed or palsy muscles. First of all, this is called pan electrode, which also known as anode, and this is black one is cathode electrode. There are 7 to 8 motor points in the facial nerve or face region. We start the treatment. First, stimulate the motor points of facial area. Wash or rinse with a spit or any antiseptic. Put the pan electrode in the first area called, this is a frontalis, add कर देना इस पर, frontalis muscle. First of, this is a frontalis muscle point, motor point. ठीक है? ठीक है. You see the contraction of frontalis muscle. Now again clean with any antiseptic. Second one what is corrugator muscles, which motor point is located here. Place the pan electrode in perpendicular and just little bit move, increase the intensity. कितना
करना अब ज़्यादा
This is the corrugator muscles which work downward the eyebrow. The red, when you apply the pan electrode, you see there is a red spots blink on the face. This is temporary. Now the third muscle is nasalis. आँख बंद कीजिए. Nasalis metal point is there. When you put the electrode here, the contraction of the nasal muscles and eye muscles are there. बढ़ा रहा हूँ मैं धीरे धीरे. चालू हुआ. You can increase the intensity slowly. Relax छोड़िए. You see the contraction of the nasal muscles and also in the oculi muscles. ठीक है, ये तेज करो.
नहीं ठीक है.
Next one is the auriculus oculi superior. The next motor point is auriculus oculi superior, which motor point is here. When you put the electrode, you see the construction. ठीक है. You see the contraction of blinking eyes. You can never put down the electrode much more time over skin area. It maybe causes inflammation of the eyes. Now this is the point of auriculus oculi inferior. You can put here electrode and see the contraction of eyes like this. Relax. Again contraction of eyes and relax. Now again zygomatic facial. When you increase the intensity, you see the contraction. Just like a smile, because in the facial palsy the main thing is the patient lost his smile. See the construction. Now going to the next level, we're going to the orbiculus oris. The motor point of this muscle is there. When you increase the intensity, it shows a fluffy lips, like you can blow it in like this. Now again we down. The next point is acted on that area. You see the contraction like a fluffy lips. Now going to another motor area. This is called which is also related to the facial muscle, or say neck muscle. This motor point is there. When you put the electrode here, you see the contraction like this. Now again, this is the motor point of SCM. Feel the SCM, sternocleidomastoid. This one, place an electrode. You see the contraction. These are muscles, the facial nerve. This is the root of facial seventh cranial nerve, facial nerve, which supply in the three waves like this. This is called mentalis, zygomatic, frontalis, zygomatic, and mentalis. When we applied the root area of this nerve, we can see the two both movement like this. You see the contraction in eyes and lips both. This is the root of this nerve, and again we place this nerve like frontalis here, frontalis branch. You see the contraction here. Again, this is the pulsinator as zygomatic area. Increase the, you see the most work of upper lips. And the third branch is mentalis. When you place this area, this is a electrophysiology. Now some massage are doing like this. It circulate or improve the circulation of the muscles on the nerve, which helpful to decrease the inflammation of facial nerve. This and that, this and that. Close.